7. Hidden dangers of nursing homes you must know if you're old and alone. Before we dive in, please leave one subscribe, one comment, and one like for this valuable video of yours. And don't forget to share it across your social media to help others stay informed. In this eye-opening video, we'll uncover 7 hidden dangers of nursing homes that every senior, especially those living alone, must know. While some facilities provide excellent care, others conceal risks that can deeply impact your health, dignity, and safety. Whether it's neglect, isolation, or financial abuse, these silent threats can go unnoticed until it's too late. Stay tuned and protect yourself or your loved ones with this vital information. Number 1. Silent neglect. One of the most overlooked dangers in nursing homes is silent neglect. Unlike visible abuse, neglect often hides behind a smile or polite conversation, making it harder to detect but just as damaging. It happens when staff, due to being overworked, undertrained, or indifferent, fail to meet a resident's basic needs. This can include missed meals, skipped medications, lack of hygiene support, or failure to respond to calls for help. Imagine going hours without water, lying in the same soiled bed, or missing vital medications simply because no one checked on you. It may not be intentional cruelty, but the effect on your health, dignity, and spirit is just as devastating. Many facilities are understaffed, especially during nights and weekends. This leaves residents vulnerable to unnoticed injuries, infections, or emotional suffering. When family doesn't visit often, or there's no one to advocate, silent neglect can go on for weeks or months. What makes it especially dangerous is that many seniors don't complain. Some feel they'll be labeled as difficult, while others may not realize they're being neglected due to cognitive decline. That's why vigilance, regular visits, and clear communication are essential, because neglect, though silent, can speak loudly in consequences. Number 2. Emotional isolation. Emotional isolation is a hidden danger in many nursing homes, quietly affecting countless seniors every day. It might seem strange. After all, nursing homes are full of people. But despite the constant activity, many residents feel profoundly alone. This isolation doesn't come from being physically alone. It comes from a lack of meaningful connection. Staff members are often stretched thin, focusing on tasks rather than conversation. Family visits may be rare, and friendships between residents can be difficult to form due to mobility issues, hearing loss, or memory problems. Over time, this lack of emotional engagement can take a serious toll. Studies have shown that emotional isolation in the elderly can lead to depression, anxiety, and even accelerate cognitive decline. It can weaken the immune system, increase the risk of heart disease, and shorten life expectancy. The mind and heart need connection just as much as the body needs food and medicine. For seniors who are already alone, entering a nursing home can sometimes deepen the sense of loneliness, especially if they're not given opportunities for interaction or purpose. That's why it's critical to choose a facility that values emotional well-being, offers regular. Number 3. Financial exploitation. Financial exploitation is one of the most alarming hidden dangers in nursing homes, particularly for seniors who are alone and lack a strong support system. This form of abuse can range from subtle overbilling to outright theft, and it often goes unnoticed until it's too late. Some nursing homes may inflate costs, charge for services not provided, or add hidden fees to bills, taking advantage of residents who may not fully understand their finances or feel confident questioning charges. In more severe cases, staff or even other residents may steal cash, jewelry, or personal belongings from vulnerable individuals. Elderly residents with cognitive decline are especially at risk. They may not realize something is missing, or they may be too afraid or confused to speak up. Without regular oversight from family or trusted advocates, it's easy for abusers to take advantage, and hard for the victim to prove wrongdoing. The emotional toll of financial abuse is just as real as the financial one. It damages trust, creates fear, and strips away a person's sense of security and dignity. Regular financial reviews, locked storage for valuables, and choosing a reputable facility with strong ethical standards are essential defenses against this often silent threat. Number 4. Overmedication for convenience. Overmedication, often referred to as chemical restraint, is a troubling but common practice in some nursing homes. Instead of managing behavioral challenges through proper care, engagement, or therapy, certain facilities turn to powerful medications to keep residents quiet, docile, and compliant. These drugs, typically antipsychotics, sedatives, or tranquilizers, may be given not for medical necessity, but for the convenience of an overworked or poorly trained staff. Seniors who are agitated, confused, or suffering from dementia may be medicated simply to reduce the demands they place on caregivers. The consequences can be severe. Overmedication can lead to drowsiness, confusion, increased risk of falls, and a significant decline in physical and mental function. In some cases, these medications can hasten death, especially when used inappropriately or in combination with other drugs. What's even more alarming is that many residents and their families don't even realize it's happening. Consent may be loosely obtained or bypassed altogether. For seniors who are alone, there's often no one. Number 5. Unsafe living conditions. Unsafe living conditions are a silent but serious danger in many nursing homes, especially for seniors who are frail, have mobility issues, or live with chronic health problems. While these facilities are supposed to provide a safe, clean, and supportive environment, the reality can sometimes be very different. Common hazards include slippery floors, poor lighting, cluttered hallways, and broken or outdated equipment. Bathrooms may lack proper grab bars, handrails may be loose or missing, and emergency buttons might be out of reach. In some cases, rooms and common areas are not cleaned regularly, leading to unsanitary conditions that can breed infections and illnesses. For seniors already at risk of falls or injury, even a minor hazard can result in a life-changing incident, a broken hip, a head injury, or a hospital stay that leads to further decline. And for those who are alone or without advocates, these problems may go unreported and unresolved for far too long. Choosing a nursing home that prioritizes regular maintenance, cleanliness, and safety protocols is essential. Make frequent visits, inspect the surroundings, and don't be afraid to ask tough questions. A facility's appearance often reflects its overall commitment to care. Your life, or a loved one's, may depend on it. Number 6. Loss of autonomy. One of the most emotionally damaging aspects of life in a nursing home can be the loss of autonomy. When you enter a facility, many of the choices you once made for yourself, when to eat, what to wear, how to spend your day, are often replaced by rigid routines set by the staff and administration. While structure can be helpful, excessive control over daily life can slowly erode a resident's sense of self. This loss of personal freedom can feel suffocating. Simple decisions like choosing your meals or deciding when to take a walk may be dictated by a schedule rather than your preferences. In some facilities, residents are treated more like patients than individuals, with little regard for their unique habits, interests, or values. Over time, this can lead to feelings of helplessness, depression, and a diminished sense of dignity. For seniors who already feel vulnerable or forgotten, losing control over their daily lives can make things far worse. Maintaining autonomy, however limited, is essential for emotional well-being. Facilities should encourage personal choice, respect preferences, and involve residents in decisions about their care. After all, growing older should not mean giving up who you are. Number 7. Lack of advocacy. One of the most critical and dangerous risks for seniors in nursing homes, especially those who are alone, is the lack of advocacy. When there's no family member, friend, or legal representative regularly checking in, the chances of mistreatment, neglect, or oversight increase dramatically. Advocates serve as a vital line of defense. They monitor care, raise concerns, and hold facilities accountable when something doesn't seem right. But without one, a resident's voice can be ignored, their complaints brushed off, or worse, intentionally silenced. Some staff may assume no one is watching, which can lead to a dangerous drop in the quality of care. This is especially concerning for seniors with cognitive issues or limited communication ability. They may not fully understand what's happening, or they may be afraid to speak up. Sadly, without someone to push for answers, issues like unexplained injuries, medication errors, or poor living conditions can go unaddressed. If you're living alone, consider appointing a trusted advocate, whether it's a friend, a social worker, or an elder care attorney. Even periodic visits from someone you trust can make a big difference. In a system that too often overlooks the vulnerable, having someone in your corner is not just helpful, it's essential. Conclusion: nursing homes can provide care and community, but they can also hide serious dangers, especially for seniors who are old and alone. From neglect and emotional isolation to overmedication and financial abuse, these risks are real and often overlooked. The key is awareness, vigilance, and advocacy. If you or a loved one is considering a nursing home, do your homework, ask hard questions, and stay involved. Your safety, dignity, and well-being should never be compromised. If this video helped you, please leave one like, one comment, and one subscribe, and share it to help protect others who need this information.